Welcome to Kids Doc Talk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the Director of Telemedicine at Pediatric Associates.
Welcome to Kids Doc Talk with Dr. Jennie. Today's guest, Dr. Krystal Jerry, joined the Pediatric Associates family of companies in the summer of 2020. She graduated from the University of Texas School of Medicine at San Antonio in 2011 and completed her pediatric residency at the Children's Hospital of New Orleans in 2014. Her interests include newborn care, child development, mental health, preventative medicine, asthma, and allergies. Dr. Jerry enjoys reading, traveling, and spending time with her family. Welcome, Dr. Jerry.
Hi, Dr. Jerry. Welcome.
Hi, thanks for having me.
Sure. I'm excited to talk about mental health. We've been doing a whole series on mental health in children for the month of mental health awareness. So I wanted to bring in another general pediatrician so we can kind of talk a little bit in more broader terms of what mental health means for our patients. So first, tell me maybe a little bit of some common mental health issues that you see in your patients.
Yes, for sure. I'm here at the MDKids Pediatrics clinic here in Beaumont, Texas, and we do see a lot of common like ADHD, which is attention deficit hyperactivity disorders, in our, especially in our 6 to 12-year-old. That is something that we do see pretty commonly here in our clinic. We also see a lot of depression and anxiety as well there in our population.
Okay. I find that a lot of times when a parent hears that diagnosis, they automatically think that either a therapist or a specialist, like a psychiatrist, needs to get involved. I think a lot of times that's true, but many times I find that pediatrician is like the first step in kind of having that discussion with the parent. What do you see as like the role of the pediatrician in at least identifying the mental health issues that you mentioned?
Absolutely. I think it's definitely important, for parents, of course, to bring their children to their regular, annual checkups there, and then to discuss any concerns that they have about, their child's behavior with the provider. And I think that should be the first steps. That way they can get the support and the care that they need in the direction as well there. As far as like your pediatrician, of course, our responsibilities are to perform screening, tests to check for, developmental delays and also mental health disorders too. And then we can provide referrals, when needed in terms of that, or discuss treatment plans and options for different diagnoses.
I'm happy that you mentioned well visits because I think some parents really struggle with recognizing the importance of the annual well visit unless either they have a specific concern they want to bring up. So, right, they're incentivized to come in for that visit, or unless they need a form for school. I sometimes find that certain ages are really, really hard to get in for those checkups because understandably it's a busy time. Like if we're talking about the summer, which is mostly when the back to school rush is, sometimes parents just forget because it's not a priority. But how often are you identifying mental health concerns on the well visit and the parent really is surprised by that? Like how often is it sort of new information for them?
It is pretty common, I would say, as we're going through the developmental screenings and we're finding, things that are, checked off and then trying to clarify or readdress this with the parent, it does bring up questions, and then those, it leads to more discussion. And then from there, the parent becomes more informed or, has a discovery that, maybe they do have a concern, about their child's behavior. So, I definitely think for sure the checkups and bringing your concerns to the provider is very important.
Yeah, I think it really reinforces the importance of those annual well visits, even if the child is doing fine and you think they're healthy and everything's fine, and maybe you don't need a form for school that like right this one year. It's really still important to keep on top of those well visits, especially as we get into the older patient populations where maybe they're not as likely to share certain information with parents. And like you mentioned, sometimes those diagnoses ends up really revealing themselves on those critical appointments.
Right. Absolutely.
So let's say that a parent does think that something is wrong. What, in terms of mental health, for their child, what are some strategies that they can use at home to either extrapolate more information or really support their child's mental health?
I think it's important to talk to your child about how they're feeling and asking open-ended questions in terms of, how are you doing today? How are you feeling? What can I do to make you feel better? And then also in terms of supporting your child's mental health, it is important to try to provide, as much as possible, a stress-free environment or to reduce the stress in your child's life. Studies show that, stress and trauma can trigger, your child's mental health. There, it is also important to increase your child's physical activities and work to improve family wellness there, doing family fun activities, and encouraging, of course, also good sleep at night and healthy diets.
I think that a lot of times, at least the parents that I'm seeing, and I'm thinking you have a similar experience, when I propose the idea that they may have a mental health diagnosis, whether it's ADHD or anxiety or depression, there's still a little bit of stigma to that diagnosis. They aren't thrilled that their child may have this diagnosis because now, right, there may be a little bit of stigma associated with, specifically in terms of medication. So I have had a tremendous amount of challenge getting families to accept the diagnosis because they're very, very nervous that now their child, it automatically means, right, that we're going to try and medicate that child. Do you have similar experiences, and how do you approach those families?
Absolutely. I always lead with, talking to parents about, let's just make sure we figure out what's going on with the child first, because, diagnosis, the proper diagnosis is important, at least some more awareness. For example, if a child does have ADHD, you don't necessarily have to jump to medications right away. I do feel like if that diagnosis is there, you do need to, identify it, because then you can have the child have accommodations, provided for school and extra support and assistance that can help them be more successful academically. I always talk to parents about, medications and side effects and tell them that, we don't necessarily have to jump to that right away. There are other options that can be considered, including, behavioral therapy and counseling as well.
For sure. I always tell people that the diagnosis is a tool, right? It's a tool that helps you get the services that you maybe need at school. It's a tool that helps you get the therapies that you need to feel better. And then medication and therapies and all those things are also tools. And they're tools to help that child, be productive and really overcome the challenges that they're having. So I think that approach tends to work well. You mentioned stress and anxiety and how sometimes those will trigger or increase the likelihood that a child is going to develop mental health issues. How can parents help their children cope with stress? Because unfortunately, that's part of our daily life, right? We're not going to eliminate stress completely, nor should we. But what are some tools that we can give children to cope with their daily stressors?
Absolutely. So, just also, fostering a nurturing environment is important. Making sure that your child is getting the proper amount of sleep each night as well, eating well, reinforcing, regular physical activities, at least an hour a day, limiting screen time, encouraging family fun activities as well, is important, and quality family time. Listening to music, sometimes calming music can help. Maybe also too, kids yoga. It's also been discovered to help kids who do from stress and anxiety. There, and then there's some tools too that parents can find, with reliable websites such as like CDC.com. The National Academies has like toolkits for parents and strategies that they can use to, it's forms of cognitive behavioral therapy to help with addressing negative thinking, things that parents can do to help in terms of when they're feeling anxious or nervous.
Okay. I love that. I think those are all really probably fantastic concrete ways that parents can really help build some resiliency into their children's lives. It's hard for me to talk about mental health without asking about or thinking about social media. And I think that organically comes up. And I think every conversation when we talk about children's mental health, what do you think the impact of social media or technology in general is on children's mental health?
we have definitely seen that there have been some negative impacts with social media. For example, increases in cyberbullying, increases with online sexual predators, increases in patient pediatric population depression, anxiety, obesity. Kids who are on social media a lot sometimes can experience, issues with sleeping, not doing well academically at school. And then even too, in our teenagers, sometimes there can be increased risk for sexual behaviors and substance use. I mean, we of course we live in a digital era, which is, has its benefits and it has its risk. And, for many of us, social media has been integrated into our lives. And so the thing is, though, children can fall susceptible to those negative influences of social media and it can greatly affect their mental health. And so there just has to be this healthy balance, I feel, and with limitations on social media for kids to help, avoid those dangers there.
Do you have any concrete limits, or kind of how do you guide families that you see in terms of like how to have the conversation with kids, what's appropriate in terms of limitation? Because there's obviously like a spectrum, right? You can have families who say absolutely right, no technology, no social media, like no smartphones, etc. And then you have parents who are like, here they needed to communicate, and like at this point, right, the genie's out of the bottle and can't put it back in. So how do you help parents like navigate that kind of balance? Because it's probably tough. I mean, I don't know, my kids are little, they don't this isn't an issue yet, but I imagine as it like comes down the pipeline, I think it's going to be really challenging to implement boundaries with this.
Right, absolutely. And it's hard, because every child's situation is a little different. You have some kids who a lot of their schoolwork is on, the computer and whatnot there. So I think, parents just have to, figure out, what works best in terms of, their limitations. I would encourage parents for sure to watch the social media programs that their children are looking at for supervision, try to evaluate the social media, the games, the videos that your child is going to be, working on or using in advance to ensure that it is appropriate. I think more so counseling too, especially with your older kids and your teenagers about what you're posting online. Because sometimes if you overshare information, that can have, affect you very negatively. And sometimes it's not able to be deleted. In terms of limiting screen time, there, certain rules about, 2 hours and whatnot. But, it also comes down to what works best with your family. I know healthychildren.org does have a media use plan that you can actually, go and kind of establish to kind of design your own family media plan. And I think that sometimes can be helpful kind of with setting limits for your family.
So I have to say, I used to recommend that to parents all the time. And very recently, maybe about a year ago, I tried it at home with my kids. So my kids are 11 and 7. I think they were 10 and 6 at the time, my big kids. And we like did the whole right, you sign a contract with how much screen time, right, you're sort of like okay with. And we had a whole discussion. And I think they found it, especially at that age, like very empowering to like have a voice in the discussion, right? So it wasn't just me coming down and saying like 2 hours a week, take it or leave it, like this is how it is. By the way, but at the end, we still got to the 2 hour, like the end goal was still, we're only going to do 2 hours a week, but they kind of got there on their own. And I think that also I found to be like very eye-opening that when children feel part of the process for setting limitations, I think in any context, that it's much more likely that they are going to stick with it. Because now whenever they ask for additional screen time, I'm like, hey, like it's out of my hands. Like you guys decided this. Like, remember we signed the contract, it was the whole thing. This is your idea. Like, I don't make the rules. So I think that also ends up being much more effective than someone just saying like, right, no smartphone, no social media, like no whatever, no cartoons, etc.
Right.
How about just approaching mental health in general, like having that discussion with kids? How can families foster that open communication and all these things that, right, you're really a proponent of? How do parents kind of like build that relationship at home?
I think in terms of discussing mental health with your child, definitely provide a safe environment, for your child to discuss his or her feelings, where they can share openly with you without feeling judged or that they're going to be, ridiculed or fussed at. definitely ask open-ended questions. That way, that gives the door, allows them to express themselves a little bit more to you in terms of, how they're feeling and what you can do maybe to support them or help them feel better. Parents, should definitely, listen to their child too, and also remain calm and positive. I know sometimes it can be very frustrating, to have these discussions and talks with your child. But, just letting your child know that you are definitely here, to support them and that you love them, I think, does go a long way.
I love that. That's excellent. Thank you. Anything else? Any like pearls or takeaways? Anything you really want to make sure that families walk away from this conversation knowing?
I think just recognizing definitely the signs and symptoms of some of the most common mental health disorders in children. For sure, if your child is actively suicidal, then of course that is a medical emergency, and you definitely, need to go to the ER right away or call 911. But, for sure as well, talking with your pediatrician about concerns that you have, regards to your child's behavior and mental health. That way that you're able to obtain the proper care and also support.
Excellent. Well, I want to thank you so much. This was such a great conversation. It was always wonderful to speak to another general pediatrician who's like on the front lines of seeing these families. And I really, really appreciate your time and your insight.
Thank you so much. Thank you for having me.
Yeah.
Make sure you like us on Facebook and follow us on Instagram and Twitter. Thank you for joining us on Kids Doc Talk.